Prehab, have you been trying everything to try to take control of that SI joint discomfort? Let me show you how to handle it today. Prehab, welcome back to the channel. Dr. Lauren Linus, Doctor of Physical Therapy, and today let's talk about SI joint discomfort. So my goals for today are number 1, to teach you about the SI joints. Number 2, to teach you about SI joint dysfunction and SI joint pain. Number 3, to teach you a few exercises to start with to really start to take control of this. And then number 4, to empower you to truly take control of your health. So let's start talking about what exactly the SI joint is. The SI joint is where the sacrum, or the triangle bone here, comes and meets the ilium, okay? In the literature, SI joint dysfunction is defined as aberrant movement of the joint, or somewhat of abnormal movement around the joint. Now, keep in mind that the SI joint doesn't really move all that much. We actually know that it has about 1.6 millimeters of translation and only rotates about 4 degrees. The literature also states that SI joint pain is where we have some sort of damage to a structure that surrounds the SI joint, or some sort of damage to the capsule of the SI joint as well, okay? So let's do a little self-assessment here. If you are dealing with SI joint dysfunction, you may have pain right about here. So if you take your finger and you point or poke to where you're having pain, that's gonna be right about here, or where you have those dimples on your back, somewhere in here, or about 1 centimeter within this area, yeah, you may be dealing with some SI joint dysfunction or pain. So what do we do about it? How do we address this? Well, credit should be given where credit is due. Some really awesome literature by Mark Laslet recently is showing that inflammation around the joint can be one reason that we deal with pain or dysfunction, and then the other reason can be actual damage to a structure surrounding this area. But what we do know in regards to addressing this pain or discomfort is that working on exercises that really improve lumbopelvic stability is a really, really good way to start to take control of this issue today. So I'm going to show you a few of my favorite exercises to get started. All right, prehabbers. So as I mentioned, working on exercises that help to improve our lumbopelvic stability is a great start to taking control of this SI joint dysfunction or SI joint pain, okay? And what I mean by lumbopelvic stability is working on the muscles that surround the hips, the low back, the core, the hamstrings, adductor, groin muscles, you name it. I'm going to show you a few exercises today to start to work those muscle groups. So our first exercise is going to be a bridge with a hip adduction. So I want you at home, join me. Grab a yoga block, grab a small ball, grab a foam roll. It can even be, 2 rolled up beach towels, whatever it looks like for you. Grab it. You're going to lay on your back here, and you're going to put that yoga block or whatever it may be in between your legs. Now what we're going to do is gently squeeze, put a little bit of pressure on that yoga block, and then I actually want you to think about tucking your hips under, right? So we're tucking our hips a bit, we're feeling our core muscles engaged, keeping a little bit of pressure on that yoga block. Hands are comfortably at our side, and then from here you guys are just going to lift those hips up off the table, engage the glutes, keep that core tight, and you're coming back down. Okay, so one more here, tuck that pelvis, a little pressure on that yoga block, come up, squeeze those glutes together, and then come back down, okay? So especially with SI joint dysfunction and pain, you wanna do more of what feels good, right? So if you're doing something and it's not feeling great, try to do less of that. Okay, so if you're working through this exercise and you get to that top of the motion, you're like, ugh, that makes it a little bit cranky, I want you guys to try to work through a smaller range. So that could look like coming from here, even up to here, okay? If working through any of that range of motion makes your SI joint a little cranky, then all I want you guys to do is start with just squeezing that yoga block. So core is tight, right? I'm tucking my hips a little bit, and then all you're gonna do is just gently squeeze, hold for a count of about 5 to 10 seconds, and then relax, okay? So as I mentioned, it's doing more of what feels good for you, doing less of what doesn't feel good. Squeeze, and then relax, okay? So that's your first exercise. Bridge with hip adduction. Go ahead and set that yoga block to the side. And then we're going to lay on our side here. And we want to start working some of the muscles that work on the outside of the hip here, specifically the piriformis, because it starts at that greater trochanter, kind of that knobby part on your hip, and then runs down to the sacrum. So we're going to do a sideline hip abduction here. So again, core is tight. I'm rolled forward. I don't want to see you guys rolling back. Keep those hips nice and stacked. Then I actually want you to point your toe up and out a bit. And we're going to bring our leg up, keep it back. I want you to imagine if there was a wall behind you here, right? I want you to try to keep your heels sliding on that wall. Hips stay forward. Toes going to be rotated out just a bit to get that hip in a bit more external rotation. That's really going to target some of those pelvic stabilizers on the outside of our hip, okay? Now, again, if you're doing this and you're like, oh man, it's just giving me a little bit of discomfort, try a smaller range, right? You can just go from here to here, nice and controlled, okay? Do more of what feels good, less of what feels bad with this. Good, and let's do one more. Awesome. So that's exercise number 2. Again, we want to work on improving some of the stability through the outside of the hip. If you all have a Swiss ball at home, I want you to grab that. Another muscle group that we want to work on are the muscles that run down the length of our spine. They're called the erector spinae, okay? They have some attachment points down through the hips into the sacrum. So you're gonna grab a Swiss ball at home. You're kind of comfortably lay on it on your, kind of under your hips, your belly button region. And then you can start, let's start with our knees bent. So we're in kind of a kneeling position here. Hands are gonna go behind our head, and then we're gonna come up and back down, okay? Working through what feels comfortable. You'll feel those muscles in the back of your, in your back working a little bit. Okay, now if that feels pretty easy, you can challenge it a little bit by propping up on your toes, roll the ball under you a bit more, and then go through here, okay? Again, more of what feels good, less of what feels bad. So I'm working through a range that just feels comfortable, and I want you all to do the same at home, okay? So that's exercise number 3. Again, working on some of those muscles that help to stabilize our hips and our low back, especially those erector spinae. I want you to stand on up. All right, so last exercise today that I want to take you all through is a single leg exercise. Now, I want to note here that as you start to progress with your exercises, single leg exercises are a great way to progress, but we want to start with double leg exercises. Double leg exercises such as the bridge we just did are going to feel more comfortable to begin, and as your symptoms subside, you can start to progress to more single leg exercises, as that's going to challenge your lumbopelvic stability a little bit more. So we're gonna start single leg RDL, and I want you all to start with standing on one leg. You're gonna start with a kickstand, so we're gonna have those toes of the other leg back, and then from here we're gonna work on keeping our hips nice and square. We're reaching down towards our toe, hinging at the hips, and then coming back up, okay? And that's a great way to start to progress to the single leg stuff by having that kickstand behind you. Once that starts to feel comfortable, then you can really go into that single leg work. So we're standing here, right? Same idea, we're reaching down, staying nice and strong, balancing, coming back up. My hips are staying square. I'm not rotating a lot through the pelvis. We're really working core, hamstring, glute muscles, lateral glute muscles, and our low back muscles as well. All right? And then once that starts to feel easy, you can grab a weight, do the same thing, but start to just load it a little bit more. Come in here, and coming up, okay? Now, I recommend doing these exercises without your shoes on or wearing more of like a minimalist shoe like I'm wearing. These are like the Vivo barefoot shoes, just so you can really feel grounded as you do this. I'm really feeling my big toe, my pinky, my heel, and just feeling really grounded when you do this. It's a great way to improve our proprioception, our balance, and our neuromuscular control. Good. So again, that's more of a progression. For exercises, we want to start with more double leg work, such as the bridge I showed you guys, and then we can progress to more single leg work as our symptoms start to subside. Okay, so a few other tips and tricks that you all can try to help to manage your SI joints discomforts are, number 1, just kind of looking at your habits throughout everyday life. Sleep position, how we got into and out of the car, even things such as unloading clothes from the washing machine, unloading clothes or dishes from the dishwasher, all of those and how we go about doing those movements can make a difference in managing our SI joint discomforts. So in regards to sleeping position, if you are laying on your side, putting a pillow in between your knees with a little bit of bend in the knees is a good way to help to keep our hips nice and square as we sleep. Okay, positions we want to avoid when we're sleeping, and I'm guilty of doing this sometimes, is bringing one knee kind of up to the chest, right? Laying with our hips rotated. That's just gonna cause a little too much torque through the hips when you sleep. So if you can try having a pillow between your knees when you sleep, that's gonna be a better and more comfortable position for you. The other thing that I want you guys to keep in mind as you go through your daily routines is how you get in and out of your car, right? A lot of times as we're getting in, we're kind of swinging our leg over, then sitting down. Instead of doing that rotational movement through your pelvis, what I want you to try is open the car door, sit back, and then turn your legs at the same time instead of doing this kind of funny rotation exercise when we get in. That's gonna cause a little too much rotation through the pelvis as well. So again, we can try open the door, sit back, and then rotate your legs around. So try those tips and tricks for me just throughout your everyday life and see if that makes a difference in your SI joint discomfort. Other things that we know from the literature can be helpful are injections for some patients, as well as using a compression belt or a pelvic belt just to give you a little bit more of that stability throughout your everyday, okay? The other big thing I want you all to be mindful of is be patient with yourself as you go through this. We know that conservative treatments can be very beneficial, but it does take time, so stay consistent, do more of what feels good, less of what doesn't, and start with these double leg lumbopelvic stability exercises with progression to single leg work as you can tolerate. All right, hopefully you guys learned a little bit more about, number one, the SI joints, number two, why we get SI joint dysfunction or SI joint pain, number three, a few things that you can try, and then number four, feeling like you are now empowered to take control of this. Try these exercises, let us know in the comments below how they go for you, and we will see you next time.
Hey prehabbers, if you enjoyed our content, go ahead, like and subscribe.
Or better yet, head over to our website in the description below and check out the dozens of programs that we've created to help you take control of your health today.